in Uganda.
The consumption and marketing of these fast foods and sugary drinks should be strictly regulated in Uganda in order to safeguard the public health. Ladies and gentlemen, according to our status quo in Uganda, you realize that fast foods and sugary drinks consumption is increasing in Uganda, driven by an aggressive marketing, urbanization and changing lifestyles, leading to shifting from traditional to ultra-processed foods. Then, this trend is contributing to the growing public health crisis of non-communicable diseases like obesity and diabetes, particularly among children and the adolescents. Ladies and gentlemen, if I told you to check aprcu.org.com, Uganda is witnessing an explosion in the amount of information of air disposal, an area of concern. However, is marketing of sugar-laden drinks and fast foods, which have become increasingly persuasive on digital platforms. Ladies and gentlemen, you realize that the marketing of these goods is a lot, and the consumption, the rate at which people are taking in these fast foods and then these sugary drinks is a lot, which is not doing well to our health. Let's check the big number, the minors, these are the adolescents and then the youth. It is the big number at which people are consuming these fast foods and then the sugary drinks, of which it is not doing good to our health. So we as the affirmatives of today, what are we saying? We are looking at the regulation. We are going to do it in very many ways, which my second speaker is going to come and tell you. And we are coming with 3 major reasons. First reason, health concerns, just like how I said. We are prioritizing health. Of course, health is wealth. Secondly, we are looking at economic costs. And then lastly, we are looking at regulation, because it has been effective before. We have looked at things that have been regulated, things like alcohol for minors. So regulation has been effective before. Therefore, it is going to work.
We are seeing most of these young people, the adolescents, are taking alcohol. So I wonder how the regulation they are talking about has been effective. These young people have been taking a lot of this alcohol, and you find that most of the people in these rehabilitation centers are the youth that have been affected greatly by the consumption of alcohol. So back to our case, we as Team Negative, ladies and gentlemen, we come and tell you that, you know what, instead of strictly regulating the consumption and marketing of these fast foods, we are going to come with a plan of educating them. Educating these people. How are we going to be educating them? Creating awareness platforms such as these ones that we are attending today, ladies and gentlemen, to inform the house, to inform the general public, which is the market, and they are the ones who are consuming these fast foods that they mentioned in their first speech. We are coming to create these platforms like this so that we educate, we tell these people so that when they are making their choices, they are very well informed about the negative effects of these fast foods and these sugary drinks. Now, the negative effects of some of these sugary drinks and the fast foods, we have weight gain. And this weight gain, ladies and gentlemen, comes not only in just consumption, because if I eat a plate of KFC today and I don't go back to it, I don't think it's going to cause an effect to me. But these effects come in the continuous consumption of these foods and these sugary drinks in very large amounts, ladies and gentlemen. So how is Team Affirmative going to come and regulate these things strictly? Because their plan was not quite clear, ladies and gentlemen. We are saying rejected. We are saying that in our plan of educating these people, we are going to tell them on some of the healthy lifestyles they can eat, because I know you can consume these fast foods and these sugary drinks, but if you maintain a healthy lifestyle, what are some of these healthy lifestyles? For example, this morning, some of you, ladies and gentlemen, participated in the walk, not so? So some of these things are some of the daily lifestyle that you should be engaging ourselves in actively, because if you eat that food and you go and carry out these physical exercises, you're going to burn these excess calories that are not important in your body, that are going to help you to maintain a healthy lifestyle, ladies and gentlemen.
I'll start by asking a question. What has made people smoke less? Knowing the dangers of smoking or the effective regulations that have been placed against smoking. Kalinaki Aaron, Team Affirmative, Lakeside College, Luzira. Now, my major burden here are 2 things. 1, to show you why regulation is the way to go, and 2, how we plan to regulate. But before I go into that, allow me to attack the issue of education. Now, education is part of regulation, ladies and gentlemen, if I may inform you. That is why it falls under our bracket of strict regulations. And education is not going to work. Take an example of corruption. Children are told not to be corrupt straight from their cradle days in school, but at the end of the day, corruption is still a looming issue in the country. When you look at a few years back or a few months back, Uganda was actually in the Grey Index of the World Bank. Why? Because of corruption. So education is not going to be as effective as some of the regulatory tendencies that I'll bring up in my speech. Now, our standpoint as Team Affirmative, why we are supporting the resolution. We as Team Affirmative believe that the right to life supersedes any other rights and freedoms. And the government's number one duty to its citizens is to protect this right to life. I'll come back to that later. As I was telling you, the government's number one duty is to protect citizens, is to protect the right to life. Uganda's 1995 constitution, particularly Chapter 4, mandates the protection of fundamental human rights and freedoms, obligating the government to respect and fulfill these rights of the citizens, particularly the right to life, which is in Article 22 of the Constitution. Now, why are we advocating for strict regulations? Number one, health concerns. Fast foods and sugary drinks are currently the leading causes of non-communicable diseases. This is type 2 diabetes, obesity, heart disease, and fatty liver disease. And currently, heart disease is the number one global killer, ladies and gentlemen. Heart disease is killing people at a rate faster than we can count. Now, in Uganda, non-communicable diseases are an emerging challenge, accounting for 11 to 12% of the disease burden, and 33% of all deaths in the country are due to heart diseases. Where are these heart diseases coming from? These heart diseases are coming from the fast foods and sugary drinks that people are consuming at an alarming rate. Allowed.
I would like you to tell me some of the tools you're going to use in regulation.
I'll come to that later in the course of my speech. Now, deterioration in academic performance. This is still under the health concerns, robbing the country of its future generation of elites. Now, what am I meaning here? Children are going to get heart diseases. Children are going to get type 2 diabetes. This is going to reduce their lifespan. This is going to keep children in and out of hospitals. In the end, children are not going to be able to concentrate in class. Children are going to perform poorly, and the country is going to be robbed of the elites that could probably take this country to the next step in the generations to come. However, if we do regulate this strictly early, children will be kept healthy because they will not be overly consuming these sugary drinks and the fast foods.
I'm just impressed from the first person who came and from the last person who has come and confused the house that education is not working. Because he has disrespected everyone who is here. Today we are here because of education. I wonder why he comes and tells us that education is not going to work. Today, we are talking about education. We are coming as Team Negators to educate the people on how to regulate, on how to stop taking in these things. They have told us that, they have come and told us the effects of taking in the product, but I've not had them clearly explain to us exactly them as, I don't know which team they have come, but for last we have come as the team government. How is their house coming to help us, or what are the tools? I told him about the tools he said he's going to talk about in the course of his speech. I didn't hear you clearly talking about it. They have talked about the taxing of the products that are the fast and the sugary drinks, but we are aware that the KFC is capable for paying all the taxes, because what they are planning is a short run for a long-term problem. In a short run, they will talk about regulating, and they have said this has been efficient. Then if it has been efficient, they have not brought us as something that is so innovative or that is going to be new from what has been done by the government, that they are going maybe to put something. Maybe we have not seen something from you. Even the house itself is very confused. When you talk about taxes, I don't know what you're going to tell the Coca-Cola people. Rejected. I don't know what you're going to tell the Coca-Cola people, that they are not going to pay taxes, because this is an international organization, that they have got the money to pay, they have got the capacity to pay all the taxes. I don't know, because even this house today, we are here because when you read about something, they're saying run, dance, and walk. So we can educate people on how to make physical exercises, because regulating does not answer the question of public health.
When a mother sits down her child and tells her, girl, you know what? do not wear miniskirts, do not move out at night, I believe that is education. When this girl learns about the dangers of moving out at night, the dangers of wearing miniskirts, they are going to regulate what they have been doing. They are going to regulate where they have been moving at night, at night and all those other things. Now, when we speak of education as Team Affirmative, when they come and tell us about education, we as Team Affirmative take it in a way of regulation. Why? Because regulation or education is part of regulation. Because when I set up a school canteen and I tell them, you know what, we are limiting the sale of this and this we are limiting the sale of fast foods in these canteens. We are educating. You are not going to limit something and you're going to stop at that. You are going to go ahead and educate them to why are you doing this? Why are you doing that and that? When they speak of alcohol, when they regulate alcohol, they tell you, you know what, when you drink and drive, you're going to cause an accident. When you do this and this, they give you repercussions. Meaning, with that education, you're going to stop certain activities, hence regulating, hence reducing what you have been doing. Now, when we come as Team Affirmative, we have come to show you that the consumption and marketing should be really restricted. Why? Because we are losing people. We as Uganda are losing people and house. We are a low developing country. Now, when we lose the population, we are losing labor. We are losing people who can work for us. We are losing people who can get educated and become important people in life. Sorry, I won't take it. Now, when we speak of education, we are speaking of helping people learn through through regulation. We are teaching people how they are going to learn about the dangers of these fast foods and sugary drinks, ladies and gentlemen. Through regulation, we are teaching them the dangers of each and everything. Now, when they come and tell us about the economy and everything. We are looking at the life, ladies and gentlemen. What they want to tell me is that they are going to attain a self-sustained economy without people. How are you going to attain a self-sustained economy without people to run it? Without people, those same people whom you have sacrificed, if I may use the right word, whom you have sacrificed to diseases like the heart disease, which our second speaker has told you is the #1 leading cause of death, ladies and gentlemen. Why are we losing our people, yet we can regulate, yet we can fight this in the due course? And we are telling you that we should limit and regulate these things in schools. Why? Because this is a young generation which can understand very fast and they can know the dangers very fast, let alone someone who is above 18 who is going to take it at heart. Now, when we look at regulating to the young ones, as our first speaker said, we are teaching these people from their childhood that, you know what, the high consumption of these sugary foods and everything is bad. This is why we are teaching you to regulate. And when we speak of regulation, we do not mean banning. When we speak of regulation, we are limiting the consumption, meaning you can take in something at a very small rate. Unlike Team Negative that is telling us we are going to ban, ladies and gentlemen.
Ladies and gentlemen, today as we debate about the restriction but strictly regulating the consumption and marketing of fast foods and these soft drinks, call them sugar drinks. Ladies and gentlemen, what are we advocating for here? We are safeguarding the public health, ladies and gentlemen. Team Affirmative fails to come here and clearly bring a solution to this challenge that we are facing. We have seen many people taking these fatty foods as it has been characterized from the first speeches. Thank you for understanding that. But they are failing to bring a clear policy, they are failing to bring a clear way to curb this, ladies and gentlemen, yet many people are leaving us. They come here and advocate for marginalization of people. From their first speech, they call the adolescents and the youth the minors. Imagine. Here we are advocating for the whole people, whereby every age counts, every age matters, because every chick rose from an egg.
Do you agree that alcohol has been restricted to persons under 18 years of age in Uganda, but even today children are consuming alcohol?
I am not aware of this because I did not take alcohol as a child.
Your answer is yes or no? It's fine. Do you know that producers have money to pay the taxes that we are going to use as the strict regulations?
Yes and no.
Instead of educating the consumers about the negatives and the positivities of the junk foods and the juicy sugary drinks, they just want to strictly regulate them without any education. They or still consumers will go look for that product even if they are high, because increasing the taxes or increasing the money does not stop me from my choice. The choice remains the choice.
Ladies and gentlemen, we are what we eat. Do you know about Teflon and related chemicals?
Yes.
Okay. Is Teflon safe to use in utensils?
No.
What reduced its use? Knowledge about its effects or the legal ban that caused advancements in what we use in our utensils?
Come again, you are not direct.
Why do we use less Teflon in our utensils? Because we know it has bad effects or because it was legally banned? Thank you. International Naming Standard 211, sodium benzoate. Is it true that in extreme conditions, for example, high heat, it forms benzene, a non-carcinogen?
No.
Is this present as a preservative in most fast foods and sugary drinks?
No.
Thank you. According to Dr. Stephen Westbain's popular book, Fragile Hearts, we're still here, Speaker. Blood vessels are a communication path to the heart. Is it true that cholesterol is associated with around 4 million deaths per year?
I'm not a doctor.
True or false? Fast foods are responsible for high levels of cholesterol.
Still the same answer.
Is the right to life a fundamental human right in Uganda?
Yes.
Thank you. Do you smoke tobacco cigarettes?
No.
Have you ever seen a pack of cigarettes?
Yes.
Does the pack of cigarettes entice you to buy cigarettes?
No.
Thank you. True or false? Sugary drinks and some fast foods cause your brain to secrete dopamine and serotonin.
False.
Thank you. Does this make sugary drinks addictive?
No.
Thank you. What limits an addiction? Regulation or information?
Information.
When can a bent tree be corrected? When it's young or when it's grown?
Come again.
Thank you. Ladies and gentlemen, we live in a generation where we have people driving to the gym to walk on a treadmill. And why is this? As the negatives told us, this is because gyms have become more popularized in social media than hospitals. Ladies and gentlemen, this is the same thing with information. Because we live in an information age, fast foods and sugary drinks have been marketed so much that they seem to be popular. They tell you can't have a meal without this particular sugary drink. And what does this cause? Many of the youths, many of the young people become enticed by these things. And what happens? What results from this? We have issues like diabetes type 2 and heart disease because of these attack ads that people have. And we have seen that regulation is the only way to curb and undo the effects of persuasive ads on sugary drinks and fast foods. Ladies and gentlemen, a bent tree can only be corrected when it is still young. We talked about the youth because, yes, we are not disregarding the rest of the population, but Uganda is predominantly a young country. More than 50% of the people are below 30 years, more than 70%. And when we talk to these people, when we regulate the consumption of these fast foods among young people, when you tell school canteens not to sell particular fast foods to the young people, what do? We get a generation which has grown up eating healthier. And what do? We get a healthier, youthful generation, better working population. The right to life is a fundamental right in Uganda. Yes, we have freedom of choice, but regulations do not acquire our freedom of choice. No one has been refused to smoke a cigarette, and he has agreed that he has seen a pack of cigarettes. We do not have fewer people smoking cigarettes because we know the bad effects of cigarettes. Everyone who smokes cigarettes has seen the pack and knows what they can do to him. But we have fewer people smoking because of regulations like do not smoke in a public place, regulations like do not sell cigarettes to people under 18 years of age. The preservatives in fast food, for example, sodium benzoate, when exposed to extreme heat, for example, when you use oil continuously, as local fast food vendors do, it can decompose and give you benzene, a non-carcinogen, in extreme conditions. This is dangerous to our bodies because we have seen in Uganda most of the fast food sector is informal. We are for selling chips by the roadside. Who is regulating them? How do we know what they're giving us? Is it healthy, ladies and gentlemen? And cholesterol, as we have seen, is the major cause of...
You are watching the Doc Talk Show.
When you want to relax your body and refresh your mind, welcome to Hotel La Confidential, Aroa's premier destination for luxury and comfort. The only hotel in Aroa City offering a serene atmosphere, breathtaking scenery. Come and discover our exclusive wellness club with packages that include a fully equipped gym, a rejuvenating sauna, steam bath, and a great sky blue swimming pool. For events, our state-of-art conference halls and versatile event spaces are perfect for hosting shows, wedding receptions, birthdays, and more. Come and enjoy our cinema hall and unisex saloon, all designed to meet your entertainment and grooming needs. Bring your family and let your kids splash around in our beautiful kids water park. We are located on Aroa Pakwachi Highway in the heart of Aroa City. Don't wait. Visit us on www.hotellaconfidential.com or call us on 0761 688 181.
You are watching the Doc Talk Show.
Welcome our viewers. Today in this episode we are celebrating the World Heart Day, and we've managed to bring you all the events that have happened at the World Heart Day celebrations today. So World Heart Day is a day that is celebrated to celebrate all the people that are living with heart diseases, to celebrate them as heroes, and also to celebrate all the individuals across the medical profession that help patients that deal with cardiac care. Today I have with me Dr. Daniel Iragua, an associate consultant cardiologist who works with the Uganda Heart Institute and also is a member of the committee of the Uganda Heart Association. Welcome, Daniel.
Thank you, and thank you for having me.
So Daniel, we'll go straight in. As a cardiologist, what is your role in the management of heart diseases?
So my role as a cardiologist in managing these cardiac conditions spans a number of facets. It's not just diagnosing, treating and following up these patients. We also have an important role to play in the aspect of prevention, as I think it's an important element that we really need to take advantage of, because I think it does offer some good advantages of it being cheap, in that some of the conditions that we tend to face can be caught early, and the complications that come with them can actually be prevented. And this calls for us to educate the masses on the conditions that they may be at risk of facing, and where they can actually access these services from. You may find that many people are not aware about the different services that we offer in the care aspect. And still on that, we also are called as medical doctors to be teachers, because we do have a number of colleagues that we work with, nurses, clinical officers, doctors, medical doctors, that we have to share and pass on this knowledge. Because once we have empowered them, then the work is eased on the different and few specialties that we may have in the country. So that is an important thing that I think we also tend to do as cardiologists. And the other thing is that given the field of medicine is always evolving, there's research that is always bringing up new ideas, new forms of treatment. We also have a role to play in being a part of this, because our patients are also similar to the other patients that are all over the world. We must also give them the advantage of getting these new ideas and the new tips to give them better chances at having good life.
You've mentioned something important that's related to this year's theme, which is don't miss a beat. So you see people across the spectrum. You see those with early symptoms, you see those who've just been diagnosed, and you see even those that have reached a point where their heart disease has become, has caused complications, has become critical. So you see people across the spectrum. And this year's theme is about being aware. Don't miss a beat. Don't miss that opportunity to intervene early. Don't miss the opportunity to spot your symptoms. So that's an important part of what you do. And we hear that, we know that cardiovascular disease is becoming more common in Uganda. For the public, non-communicable diseases like hypertension, diabetes are becoming more common in Uganda. According to the WHO, World Health Organization data, we are seeing an increase in non-communicable diseases like hypertension, diabetes, and heart disease. So what do you think could be contributing to this trend?
I think what is one of the biggest contributors to this trend is that there's a lot of urbanization and modernization of things, which the Ugandan people and population are adopting. And this has also come with improved pay and ease of life. Previously, in the past, people would move miles or kilometers, move from their workplace to home, or from home to school. That has been removed. Now people have all sorts of ways of getting where they want to go. Cars, motorcycles. That aspect of that physical activity has been removed. with a lot of modernization, even the type of work that is done with machines. So the other physical bit of it is not there. And then, of course, with urbanization and adopting new lifestyles and diet, you see you have a lot of these fast foods that are now available. That's at the high end, but also you can have these people that are the vendors that sell these fried chicken, fried Irish potatoes. They are easily accessible and at a cheap cost. These types of meals are not healthy. As you can see, what has been preached, we want people to have more of a vegetarian kind of meal with fruits. But we're having a lot of oily, starchy foods, and these also come with salt addition. These are not good in keeping with heart health. So I think those are some of the things that could contribute. The younger people are taking up this lifestyle of taking a lot of alcohol. There are a number of these substances that I think are easily accessible. Those are some of the things that contribute to young people getting heart conditions like heart attacks. People as young as 30, 35, that was something that was seen to occur in the much older population. But we're seeing that happening now, the smoking that people do. All those are things that I think are contributing to these things coming up much earlier. And the other thing is that people are not aware. I think also now with more increasing awareness, people seeking care, we're getting more picking these things early. Hypertension in the young people. Yeah, that's what I can say.
Good for the public to know. And you must know that at this event, one of the things that stood out to me is that we've had only healthy snacks. So we are providing only healthy snacks here. Fruit, apples, bananas are here for people to snack on. So there are no chapatis and sodas here. Because a healthy diet is one of the things that's very critical for good cardiovascular health, and that's what we are trying to encourage the public to do, to prioritize, to think more about the diet that they are consuming, to take it more seriously. So back to you, Daniel. So we have you as a cardiologist, you work with so many other doctors, so many other specialties. So what other specialties do you work with, and how important are these collaborations for you as cardiologists?
The patients that we do work on are not entirely only cardiac. So multidisciplinary teams are, I think, a very important aspect for us to embrace, because I'll get a person who will have a kidney problem, they'll have diabetes, or they may come in really critical, and what I can offer them may not be enough. I may need to offer them other care that can be offered by the other specialties. You are an emergency specialist, and the conditions that we get are really critical. They come in really sick. Like if someone has a heart attack, that is something that needs to be addressed urgently. Because the longer you take, if someone is having a heart attack, more of their heart muscle is dying. So the emergency people that are on ground who are in contact with these people, if well equipped, they're able to bring the patient to our facilities where they can get the ultimate care that they should get, and be able to save them and prevent them from having complications.
Are there any advances in cardiac care that the general public or maybe other people across the profession should know about?
Over time, with passing time, improvements in treatments, I can just start from the simple things like medicines. Previously, there are limitations to the medicine ranges that we offer our patients, but people have developed new molecules, and there are quite a variety, and we've been able to see that most of the patients are able to get the right treatment. That's, I think, one positive in regard to the advances that are coming. And of course, with increasing knowledge, we are aware that now this works, so we tend to shift what is working and try to offer it to the patients. In terms of interventions, there are a number of interventions that are being done, like coronary angiograms for both diagnostic purposes, but also for therapeutic purposes. I talked about a heart attack. Sometimes that happens because they have blocked blood vessels supplying the heart muscle. and these can be unblocked and blood flow restored to the muscle that was dying. Those are some of the things. The advances in heart failure treatment. We have drugs, but there are also devices like pacemakers, like a CRT that was talked about by the director. And surgeries are also being offered to some of the patients that need them. At least what we are offering now more often is valve replacement surgery. So some of the patients with bad valves like rheumatic heart disease, they have that benefit of getting that. And of course, we are continuing to improve and we strive to get better.
Dr. Daniel, tell us more about what CRT is.
Okay. Yeah, so like I stated earlier, is that it's an advanced form of care offered to patients with heart failure, but they have to qualify for it. Not everyone does qualify for it. It's a special category of people who have big hearts, they're on heart medication, but the heart medication is not improving their symptoms. They also have to have an ECG finding of a left-banded branch block, resulting in the Graft complex, about 140 milliseconds. So this is a procedure that involves making a small pocket around the collarbone and then having access of leads that are delivered within the heart. So these leads are placed in such a way that they help the right and left side of the heart, the ventricles, to work in synchrony as compared to what they were having before. Once you have this synchrony achieved alongside the medication, you usually tend to see good outcomes for them, and they tend to do well. Yes.
So that's cardiac resynchronization
Correct.
therapy. Thank you. So that's one of the advances in cardiac care. So for the public, Uganda Heart Institute is one of our leading facilities in terms of cardiac care. Am I right, Daniel? I think the first open heart surgery was performed in Uganda Heart Institute, if I'm not mistaken, and it's one of our facilities that sees very many cardiac patients and has been very, very pivotal in our cardiac care in Uganda. Thank you so much, Dr. Daniel. So with that, I'll just let you go. Thank you so much for your time.
You are watching the Doc Talk Show.
Agriculture is Uganda's economic backbone, employing about 70% of the working population and contributing 20% of the GDP. As the world becomes a digital global village, ICT has proven to increase productivity in the agricultural value chain. UKUSAF, through its Strategic Plan 3, recognizes the importance of access and usage of ICT-based tools, information and knowledge for farmers by providing them the needed skills to live, learn, work and participate in a digital society.
We came up with a project which we took to UKSAF, and we're happy that UKSAF supported it. That project is called ICT for Farmers. What did we get from ICT for Farmers? We managed to skill up to 100,000 farmers.
You are watching the Doc Talk Show.
Welcome back to the Doc Talk Show, and in today's episode we are celebrating World Heart Day, and with me I have one of the key stakeholders in cardiac care in Uganda, Dr. Twalib Aliku, who is a senior consultant pediatric cardiologist. Welcome, Dr. Aliku.
Thank you, Dr. Kamara, for having me.
So we'll dive straight in. What are the common cardiac diseases that you see in children in Uganda?
Heart disease in children are divided mainly into two. There is the congenital heart disease, where children are born with a heart problem, and then there is acquired heart disease, where children are born with a normal heart problem. Heart, but eventually they develop heart disease. So of the congenital heart diseases, the commonest are holes, what we call holes in the heart. They are basically defects within the walls that separate the different heart chambers. The commonest we see in Uganda are ventricular septal defects, which are holes within the main pumps of the heart. That is the most common congenital heart defect we see, followed by patent ductus arteriosus, which is a normal condition in newborn babies, but it's supposed to close within 3 days. But unfortunately, in some cases, it doesn't close. That hole doesn't close and can affect the child when it is a big hole. The common acquired heart disease that we see is rheumatic heart disease, which follows untreated sore throat because of a bacterium we call Streptococcus. So this typically affects school-age children between the age of 5 to 15 years. So these are the common heart defects we see in children.
Thank you, Dr. Twalib. So these are the common heart conditions we see in children. So for the public, most of us only think about heart diseases. When we think about heart diseases, we only think about adults. But heart diseases are just as prevalent in children as well. So what do you say about screening for these heart diseases in children? How important is early screening to prevent the long-term complications of these cardiac diseases in children? And how early can this screening be done?
So I just want to backtrack a little. Of the heart diseases children are born with, what we call congenital heart disease, they're divided into two. There is cyanotic heart disease, which makes children blue because blue blood or blood without oxygen mixes with blood which has oxygen. That is called cyanotic heart disease, or a child with which causes a child to be blue or to be cyanose. The commonest of that we see in our country is tetralogy of Fallot. And then there are those which don't cause a child to be blue. This we say are cyanotic, and the commonest are the ventricular septal defects and the patent ductus arteriosus we see in our country. So screening for heart disease is very important. Early diagnosis is very important. So this helps us to start treatment early, to give advice early, to educate parents and caregivers early, to know what to anticipate. So it's very important that heart disease in children is recognized early. How can we recognize heart disease in children? So for children who are born with a heart disease, the earliest opportunity is ideally when they are undergoing routine antenatal care during pregnancy. The mother can have a scan that can look at the child's heart and say maybe a child's heart rate is too slow or too fast, or the chambers in the heart are abnormal. So this child can be referred appropriately. So that's the earliest opportunity we have. Unfortunately, many of our mothers do not get that opportunity to have a scan. If they get, the providers who provide that scan are not trained to recognize heart disease in utero. The second opportunity we have is at birth. At birth, that if a child is checked by a trained health worker and recognized to be abnormal or to be cyanose or to have difficulty in breathing, that child can then be referred appropriately. There is a test we call pulse oximetry to check the oxygen levels. We know that if that test is offered to a baby, a newborn baby, it can detect some of the critical complex cyanotic heart diseases at birth, or at least before discharge from the hospital at birth. Unfortunately, this test is only available in some selected facilities, mainly in private and probably in urban centers where there are doctors who attend to these newborn babies. So if you miss that opportunity, there is at least the first contact after birth, which is 6 weeks. Some heart diseases in children can be recognized at that time when they come for the first immunization. Usually those heart diseases are diseases which come with increased blood flow to the lungs. These diseases can be recognized. Number one, the child is breathing faster than usual, or is having difficulty in breathing that the health worker can notice, or the child has failed to gain weight. By 6 weeks, they have not added on to their birth weight. Or many times the child sweats in the forehead, especially when they suckle, or they have prolonged suckling. So that's also an opportunity for the frontline health workers to recognize at least suspect that there is a heart disease and a child is born with a heart disease. Now, if a child misses those opportunities, of course the child will come with complications. And the commonest complications are poor weight gain. So you find a child who is not able to gain weight. You find a child who is having persistent difficulty in breathing. You find a child who is repeatedly admitted for pneumonia. They are always getting cough, which needs hospitalization. That is when now, unfortunately, they come. But by that majority, if a child is not recognized by 1 month of age, those who have 50% of those who have critical heart disease will have died. 50%. So it is important that screening is done early. So how may this screening be done? By the sonographer who performs the obstetric ultrasound, by the midwife or nurse or doctor attending delivery to recognize, by the midwife or nurse who is giving immunization, or by the doctor or clinical officer who is attending to this child with complications now of pneumonia, poor weight gain, and the rest.
So there are a number of opportunities that exist to catch heart disease in a child, and it's good early. And though you've already gone into this, I was going to ask you what some of the challenges are in identifying and treating, and you've already told us some of the challenges in identifying these illnesses, because for example, many people don't get fetal cardiac ultrasound. Maybe they get the normal obstetric ultrasound when they're pregnant, but it's not comprehensive. It's not one that's detailed enough to capture that. So yes, so you can take us through some other challenges you face in identifying and even treating, because we are in a low resource setting, so even managing is not easy. Yes, so let us know more about that.
Thank you. Across this spectrum, unfortunately, of care, there are many bottlenecks or challenges, not only in diagnosis before birth, but immediately after birth. There are good news. There's good news always, that now more than 90% of our children are attended to at birth by a skilled health worker. At least that challenge we have overcome, that people are not attended to at birth by skilled people. I think the challenge now there is the lack of education and skills for these lower cadre health workers who attend to these mothers. So we need to educate them and train them about how to recognize heart disease. Because children at least have an opportunity to come at least once to encounter a trained health worker. So I think the opportunity there is to train more. That's one challenge. Of course, the other challenge, which is difficult to overcome, is access to key diagnostic tests. For us to be able to accurately diagnose heart disease, we need a test we call an echocardiogram, which is a heart check, a heart ultrasound, a scan of the heart. Unfortunately, in our country, this is only so far available only to a few selected centers, mainly in the cities. We are trying to expand that scope by training more doctors, by task shifting, training nurses to be able to do that. I think now we have some nurses in Tororo, in Atutur, in Lira, in Kwitgum, in Gulu, in Arua, who are not really doctors, but they have been trained to offer that screening. So we are trying to bridge that gap, that technological gap, that access to the diagnostic test is not there. So after that, there are limitations in, of course, population awareness. Not many of our people are aware of heart disease. They many times think that it is caused by witchcraft, it is caused by being bewitched, it is a curse, and yet it is really the cause is not known and the parents are not to blame. It is really chance in most of the cases. So we have those challenges of knowledge, general population awareness. And then of course there are challenges in care, in treatment once you've been diagnosed. The drugs, you need to take drugs until the child is operated. So there are challenges in drug supply. There are also challenges in accessing definitive care. For example, surgery. It is quite costly. I must say that for heart disease in children, now there are diseases, we want no child with that heart problem to die in this country. For example, a child with PDA anywhere in this country, we will treat you for free. We will treat any child with a heart disease called hepatic ductus arteriosus or coarctation of the aorta for free. The only challenge is you should be identified. Now this is where the challenge is. So there we've made some progress. Of course, there are children who need open heart surgery. This is still limited. We are trying to increase the scope. We hope in the next 5 years we will put heart centers, regional heart centers, at least 4, and then we are able to overcome that barrier. So that's another challenge.
Thank you very much. So what would you advise, like, for the parents out there watching, for the healthcare workers out there watching, what general advice would you give them in terms of recognizing early signs of cardiac disease in children?
Thank you. That question is very important because the parent is the first person to stay with the child. So you can tell that your child has a heart problem by some common signs. For example, a child who is not growing as expected, a baby who is not growing as expected, a baby who is having difficulty in breathing, a baby who seems to get tired easily, is not playing with other children of his age group. He could be having a heart disease because they get tired easily, they don't have energy. A child who is frequently falling sick, always with cough, it could be a heart problem. If a mother is breastfeeding and your child breastfeeds a little, stops. Breastfeeds a little, stops. It means the child is getting tired just by breastfeeding. That's another sign. And then, of course, a child who looks different. I've not talked about this. A child who looks different from others. A child who is growing slowly. A child who is not speaking. A child who is not seeing. This child could be having a heart problem because a heart problem is a commonest congenital problem. So any child who is looking different from other children, they are not growing at the same pace, they are not having the same energy levels, they are not speaking like those children are at high risk of having heart disease, and so the parent can recognize them and at least ask the doctor to listen to their heart. We are here, the theme is don't miss a heartbeat. So ask your provider to listen. And this is what I tell mothers, please ask your doctor to listen to the heart. Many times we can recognize heart disease by listening to the heart. There are things we call heart murmurs, noises in the heart. This is usually the common symptom when the doctor checks.
Thank you very much. And thank you very much, Dr. Twalib. You've given us a lot of information, a lot of useful information for pediatric cardiac illnesses. And most important for us to know is that children also suffer from cardiovascular illnesses. Some they are born with, others they acquire along the way. There is one commonly acquired here called rheumatic heart disease. It's quite common. One would think that if your heart is born healthy, then you cannot fall sick. But it's possible to fall sick, get an illness in your heart muscle, and you develop a cardiac illness. So thank you very much. And we are going to take a short break. Thank you, and stay tuned to the Doc Talk Show.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quizmali Production, we specialize in content creation, digital media marketing, media buying and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quizmali Production, your partner in media excellence. Visit us at Quizmali and let's create something amazing together.
Exercise can't be sustained. Eating can't be stopped. It's even harder to lose weight. Come and give it a try. Ginshikang L-carnitine chromium capsules. Plant extract, scientific ratio. Take 3 capsules each time. The active ingredient accelerates fat burning, eat twice a day. Don't take a detour. Weight loss starts now. Ginshikang L-carnitine with chromium capsules helps you stay in shape. Please follow medical advice when taking this product. For more information, visit our website www.hgo